Okay. Elizabeth, spell your first and last names for me. Just make sure I get it right.
Elizabeth, and the last name Tombs, just one O.
Perfect. And your title?
Certified nurse midwife.
Okay, perfect. Now, one of the things, well, let's talk first of all about the fact that the area that we're in, new to
Yes.
Brownfield,
Yes.
and rare for hospitals. Talk
Very
about
rare.
that.
So Brownfield Regional Medical Center is really groundbreaking at this point and setting what I'd like to think is a great precedent for the West Texas area. We're going to be offering all options to our low-risk women. Previously, low-risk women who wanted a water birth needed to choose a midwife who birthed either at a birth center or in the home, and which you can find in which are great options. But when you choose that option, then sometimes, not often, but sometimes you need to transfer into a hospital. So what Brownfield Regional Medical Center said was, let's offer all options to the low-risk woman. So now we can do water birth within a hospital setting. So you can have, the mom can choose a low-risk birthing process that honors her body, and she can find the right position to birth in, and she can find relief if she qualifies for water therapy and for water birth. Not everybody who wants a water birth will have a water birth, but many do, and many people who want to have a water birth get in the water and find maybe it's not for them, and then they get out. And so what's wonderful about that here is you can have all options. So you might start in the water but end with an epidural, or you might come in and you were thinking epidural, but then when you got here you changed your mind and you wanted to try water first, and we ended up with a water birth. You now have the choice. Women have the choice.
So they have the choice. And another thing that you like to do with this room is the mood is very important. The mood of the room, which in turn is the mood of the patient, of the mom.
Right. So as a midwife, what I'd like to do is honor sort of what I say, mind, body, soul. There's so much to labor that's not about necessarily about the pathophysiology of labor or the mechanics of labor, but it's how that happens within her brain. This is her body and her experience. And if I can get her to relax and find what works for her and know that she's in a very safe place, then her body will relax and everything in labor moves along much better. So mind, body, soul, not forgetting that often women want a very quiet room. They want a very peaceful room. They don't want a lot of foot traffic. So here we're going to be honoring that.
And the other advantage of what you're doing by having that facility in the hospital is if there is a problem and they need to go to the ER or something, it's right here.
Right. Oftentimes, when women are choosing out of hospital birth, again, it's a very good option. But sometimes we often need to transfer into the hospital. An infant may need to have some support with respiratory effort. We're right here. Everybody is right here. There's no transfer. You're right here where everybody is. So that's kind of the beauty of it, is that you get to have all of your options and you get to have the what ifs already in place.
Elizabeth, you work with Dr. Acosta, you're a team. You need an attending physician. Is that the correct term?
So I am an advanced practiced registered nurse. So at that level, we need a collaborating physician for prescriptive authority. So my prescriptive authority agreement is with Dr. Acosta. So I consult with her for everything that I feel like I need a consult on, particularly like medications, things that I've never seen before. But often we've already looked through the guidelines and we already know kind of what I'm doing. And so I don't have to call her for every client, but she's available to me.
And not only Dr. Acosta, but you're really developing a real team here. It's a team of people that bring the birth together.
It is a team, and we have hired, Brownfield has hired several new, they're not new to nursing, they're very experienced, what we call labor, delivery, recovery, postpartum, so maternal child nurses, and it's just an excellent team. And Dr. Acosta is leading the team effort. She is phenomenal. She's easy to work with. Her patients adore her. I think she's just marvelous to work with. The nursing staff really enjoys working with her. So, I mean, we're just so lucky.
Elizabeth, you pointed out the different options, and like they could start in the pool. You talked about the fact that you want them comfortable, but describe the different things that, it looks like toys, but it's not. Describe the different things you have behind you that are options.
So the first thing is the tub, which offers what we would call hydrotherapy. So in active labor, and particularly in transition, it helps to lift the baby up, a little buoyancy, so the pressure is felt a little bit less, and moms find that that is just a dream way of relieving pressure. But we have a birth stool. So this cub that's it says cub on it. It's green. You can sit on there, and we can deliver, or you can have your child sitting on a birth stool. We can also kind of flip it around, and you hug it as you're on hands and knees. The peanut is this ball right here. That goes in between mom's legs, especially when she's laying down and we're trying to facilitate the baby to move. And then we have a birth ball, and we can use that in a lot of different ways. So, and then we have a stool over here. So oftentimes, moms who are in labor during a contraction, if you can get them in a squat, it really helps. So all of these are just lovely, what I would say, tools that help facilitate the baby to descend down and to have a vaginal birth.
Now you take care of mom, and you want dad included. Dad's allowed in the room.
Yes, so dad, partner, whoever it is that they want with them is right here in the room with them, and oftentimes I will give, it depends on how actively involved they want to be. If they want to be really actively involved, I'm going to give them a job. And so I'll teach them how to apply counter pressure. They're on drinks, so that's another big thing. With me, if you're low risk, having a low intervention and a water birth, and you can drink fine, it's no IV, so you're free to really roam. And so dad, I often put him on drink patrol, is what I'd say. And so I'd say every other contraction, make sure you offer your wife a drink.
Now this is a big deal for Brownfield, isn't it?
Yes, this is a big deal, I think, for Texas.
Mm-hmm. Yeah, and explain that. I mean, this is rare for hospitals.
This is very rare. So not as rare as what they'll say, well, we offer hydrotherapy in some capacity. For instance, you might offer to be in the shower on a birth ball, but and that is considered hydrotherapy, but that's different than getting you actually into water and letting her really sit in it and find and go side to side and have a big open tub so she can really find her position. And it is almost exclusively found in birth center and home births. And I wish it were found in hospitals. Many hospitals do have tubs. But here on the South Plains, we'll be one of the few that actually has a big tub that they can get into.
Good. I think